Hi, APU students. My name is Dr. Judy Johnson, commonly known as Dr. JJ. And in the school counseling and school psychology program here at Azusa Pacific University, I am also the clinical counseling coordinator. I wanted to take an opportunity again to welcome you to APU, or if this is an orientation meeting, hoping that you might join us at APU. And I wanted to discuss a distinction between our 48 unit counseling program and our 60 unit counseling program, and then to be able to give specifications on what the requirements and eligibility are for an LPCC in the state of California. So the 48 unit school counseling program, it's a master's in educational counseling. And for people that want to be a school counselor and get a PPS school counseling credential in the state of California, then that would be the perfect degree. For people that want to go on and become a clinical counselor or an LPCC, we have the 60 unit program. And the 60 unit program is educational counseling and clinical counseling. Now, I want to, again, make a distinction between the two so you have a full understanding as to which program you're committing to, and then you can have a well-informed decision. In the state of California now, there are many people in school districts that are in need of folks that can specialize in mental health. The reason that I highly recommend you getting the 60 unit masters with the clinical counseling specialty is because even if you just want to be a PPS school counselor, nowadays there's no such thing as just a school counselor. School counselors are expected to do lots of mental health. They're expected to understand suicide prevention, suicide education, suicide intervention, and training for staff. And in today's world, the wellness clinic, the wellness center that the school district provides is often manned with counselors that come from outside of the educational system. And often these counselors come from other licenses, but they're not truly part of that school or that educational community the way a school counselor is. So my recommendation is based on 35 years of experience in the public school system before I started working as a full-time professor at APU 4 years ago. So in networking with people throughout the state and school districts, hiring is definitely something that they consider in terms of making sure that you've got your clinical counseling specialty. So if you are a person who just wants to be a school counselor and you're certain you have a job and it's locked up because you've been a teacher and you're in a district and you know people and they love you and they're waiting for you to get your PPS credential, then that's great. But if you're also a school counselor who's just starting out and wanting to make sure that you're equipped for the job, and you will be one of many candidates that will be interviewing for these jobs, my recommendation is that you get that 60 unit clinical counseling master's because it gives you 4 extra classes. So what's the difference? The difference is those 4 classes, which are 12 extra units, and those classes are clinical counseling basic skills, clinical counseling advanced skills, psychopharmacology, and addictions assessment and addictions interventions. So those are the 4 classes that we look at when we say you are equipped to be a clinical counselor. If you're in the school psychology program and you're getting your PPS credential in school psychology with your EDS from Azusa Pacific University, and you want to do the mental health specialization to prepare yourself also for an LPCC, then the same is true. You go through all of your courses as a school psychologist, but at the end of that program or in your second year, you make sure that you also take a class in career development, which all of the school counselors get, but you will need that if you want to get an LPCC. So that's also added onto your sequence, a class in career development. And then those other classes that I mentioned. Psychopharmacology is one that you'll be getting as a school psychologist anyway, but the other classes you'll need that are not in your school psych sequence are again, career development, basic counseling skills, clinical counseling skills, advanced clinical counseling skills, addictions assessment and interventions, and then also group counseling. So for school psychologists, why would you possibly want that mental health specialization? Again, even if you just want to stay in the school system and not work privately as an LPCC, you might want it if you're doing a lot of ERMS, which is educationally related mental health services. You might just want to do more clinical work as a school psychologist, as you're in charge of designated instructional services or DIS counseling. There's lots of ways you can use that mental health specialization. There's another avenue also for school psychologists, which is an LEP, licensed educational psychologist. You don't have to have the mental health specialization or the LPCC classes for that. You graduate as a school psychologist, and then after 3 years in the school district, you then take an exam and you can work privately as a licensed educational psychologist. So there's other options. I also wanted to clarify for the LPCC fieldwork that the difference is you need to make sure if you're in the LPCC track for that 60-unit master's in educational counseling and clinical counseling, that you have 280 hours of your fieldwork hours designated to face-to-face counseling, or what we call direct counseling or clinical counseling. So 100 of those hours you'll do in your practicum, but we want to make sure that those are direct face-to-face hours. In today's world, when we're doing a lot of virtual counseling and we're doing a lot of technology like this over the internet, those are still considered direct counseling hours. 180 of those 280 hours will then be done during your field work, so that when you graduate, you have a total of 280 hours that were spent on direct counseling, not doing files, not talking about standardized testing or how to get to college. That's actual direct counseling, one-on-one with students or in groups, parents, if it's parent counseling, parent education, staff counseling, counseling with your administrator. As long as it's direct counseling, clinical counseling, then that will count towards those 280 hours that you need when you graduate out of your other fieldwork hours. If you have any questions about any of this, you can always email me. Again, Dr. Judy Johnson, jmjohnson@apu.edu. I will also be the person when you graduate that will help you fill out the forms for the Board of Behavioral Sciences so that you can then move forward to get your licensed professional clinical counselor license if that's something that you choose to do. Again, well, one last thing. Why would you want an LPCC, and how is that different from a school counselor? An LPCC is something that you can use to practice independently as an independent contractor when you're out of the school system. You can still do it while you're a full-time school counselor if you want, on the weekends or whenever you have an opportunity. It just means that you can also have a private practice and that you can bill insurance. With an LPCC, you can also specialize in other areas besides school or educational counseling. You could work with individuals or couples. You could work in community centers. You can do drug clinics or intervention. You can work with military families and in military settings. So it opens up other opportunities to use your mental health skills, mental health education, and treatment programs and plans for families and individuals. It doesn't have to just be in the educational setting. So that's Q&A with Dr. J, all things about LPCC. And I look forward to seeing you in class. Make sure to send me an email if you have any other questions. Thanks, and God bless.